Well, joining us now are Carmarthen West and South Pembrokeshire AM Angela Burns and also health policy expert Dr Paul Worthington. Thanks very much for joining us this evening.
Pleasure.
Angela, it's in your patch, that's where we're talking about. What was your reaction when you had the final decision today?
I wasn't altogether surprised because I think the direction of travel over the last decade has all been about making this move. You have to remember that for the people of Pembrokeshire and Carmarthenshire, this is the third consultation. They have been around this ballroom before, and I think that it was very clear that at some point Withybush and now Glangwili were going to be downgraded. It was inevitable.
But the medical director, the people in favour of this, are all saying pooling services leads to better services. It makes sense.
It does make sense to look at the way health is now delivered. I mean, we've all bought into, the case for change. We have different types of technologies, different types of drugs, and we all want to have health delivered in the community. But the problem is it's a chicken and egg situation because they're immediately talking about the big ticket item, the hospitals, the things that everybody's very emotionally attached to. 40,000 people submitted a petition about this very thing today. We discussed it in the Assembly. But we haven't seen the evidence of all that investment going into the community. And when you remember that in my patch, I cannot get my constituents in to see a GP on time. We are short on GPs, short on healthcare professionals, short on nurses, district nurses, palliative care specialists, you name it. So where are these community services going to come from?
Well,
and you want to take our hospital
That's a very important point, especially in terms of the hospital, Paul, because the question must be, where's the money coming from for the new hospital too?
It's a big challenge. I mean, you're talking about significant amounts of capital money, and already Welsh Government, for example, has invested in the Grange Hospital across in Cwmbran, and there's no end of capital challenges across Wales. So investing and also developing community hubs, there's a big cost to it.
And I don't want to cut across you too much there, sorry, but where's the location? Because no one's saying it's definitely going to be here so we can have trust and faith. There are no sites. I've done FOIs. There's been no purchases.
Well, where do you think it's going to be then?
Well, they say between Whitland and Narberth, but what I'm slightly worried about is recommendation 4 actually says somewhere in the south of the Hywel Dda Health Board area. Well, that could be anywhere along that whole swathe of
but would you stick to the status quo then? Because staff shortages are evident across the area. The waiting lists are high. This is the argument in favour of getting big central services. You don't buy it?
No, of course I don't think we should keep with the status quo. We do have to change. But this is exactly what went wrong with the other two consultations. They talked about the big thing, let's get rid of the hospitals, without doing all the stuff at the beginning. I'm desperately worried that hospital will go and we will not have access to GPs. We will not have the medical staff we need. And they're not going to come to West Wales during this period of transition because they're going to be worried about what's happening.
However, Paul, given your background, do you think this is a sensible idea? We're all agreed that the pressures on the NHS, on the Welsh NHS, are severe. Yes. But do you think this is a very sensible approach? I mean, listen to the anger in the voices of the campaigners on our film tonight.
There's no denying there are difficult choices here. But the NHS in Wales is facing dilemmas in 3 main areas. One, we've got there's a public health issue. We've got a growing elderly population, which we have to deal with now. But we've also got a lot of obesity, a lot of chronic conditions coming through as well. There's a wellspring of problems that we're going to have to deal with in the future. Secondly, finance and workforce. We have real difficulty attracting people. Centralisation makes sense, not just in terms of good clinical outcomes, but sensible use of skills in one team. And finance, the challenges there. But thirdly, we talked about the need for community services, and Angela is absolutely right. If we're talking about sensible re-engineering, sensible reshaping of services, you've got to have better services out to the community, especially in areas like the rural areas of West Wales.
But when people are talking about all this change, just give us an idea, Paul, what will it look like? You know, if you're a pensioner in St David's or Fishguard, what will change look like? Does it mean Skyping a doctor? What is the vision?
It's a really good question because they're a very complex set of proposals in West Wales. I think technology does play a role, and Skype and access can play a part. There's research we've done and research that have been done in Aberystwyth University that shows actually people like the older generation are actually quite comfortable in using that sort of technology. So technology will have to play a role in the future.
And just one final question to you, Angela. You know your constituents very, very well. Just looking at social media this evening, there's real anger in the area, isn't it? And that anger doesn't seem to be going away very quickly at all.
No, no. And what worries me is up until now, for the last decade, the mood music has always been about let's close Withybush. Something's going to happen there, it's going to be downgraded. Suddenly, we've put Glangwili into the mix. When I say we, I step back from that. How have I put Glangwili into the mix? I think people in Carmarthenshire are going to wake up tomorrow morning and suddenly go, oh my goodness, we weren't quite aware that this was an outcome, that this was a real possibility. Because, of course, they and the staff who all work the other side of Carmarthenshire, many of them are going to have to travel through Carmarthen and back out the other side to this new hospital if and when we ever get the funds to build it.
OK, Angela Bethan and Paul Worthington, thank you both very much indeed. Good to see you.